Gathered here to engage, exchange ideas, and open discussion on factors influencing sports performance and challenges in integrative rehabilitation. It is indeed a golden opportunity for each one of us to enrich and enlighten ourselves. Without further ado, let me call on stage our moderator, Dr. Vasudha M. Sharma, co-founder and head medical services, Vivekananda Health Global. Vasudha ma'am. Please give a big round of applause, Dr. Vasudha. For today's panel discussion, we have with us panelist Dr. P. Nandagopal. Dr. P. Nandagopal, I request you to come on dais, sir. Dr. P. Nandagopal is a health coach, therapist, and educator. We have with us Professor Usha Sujit Nair. I request you, ma'am, to please be on dais. Dean, Department of Sports Physiology. Another panelist, Dr. P. Hemant Kumar. Dr. P. Hemant Kumar, HOD Shalya Tantra, National Institute of Ayurveda, Rajasthan. Dr. P. Hemant Kumar. We have with us Professor D. International from South America. Please give a big round of applause. We have with us Professor Mark King, Professor of Sports Biomechanics, co-founder and Health Medical Services, Vivekananda Health Global, Karnataka. Dr. Vasudha Sharma is a co-founder and director of Medical Services and chief consultant at Vivekananda Health Global, an international chain of integrative centers headquartered at Bangalore. Centers in Bangalore, located at HSR and HRBR layout, offers therapies using integration of Ayurveda, Yoga, Naturopathy and conventional medicines. She has completed her bachelor's degree in Ayurveda from Government Ayurvedic Medical College, Bangalore in year 1999, master's and PhD in Yoga Therapy from S-VYASA University. Her specialization includes integrative pain management and women's health issues. Her rich clinical experience and dedication of 23 years enables her to help people restore their health and reclaim life of a doctor. Being a doctor entrepreneur, she is of keen interest in clinical practice, and her learnings help Vivekananda Health Global evolve new services and products for patients' care. In post-COVID era, she has evolved many corporate well-being programs focusing on eye health, spine health, women's health, and stress management. She pursues her interest in research by being a reviewer of Journal of Ayurveda and Integrated Medicine and adjunct faculty at Division of Yoga and Life Sciences, S-VYASA, Bangalore. Dr. Vasudha has been speaker at various forums and conferences in India, China, Sri Lanka, Italy, and United States of America. We're very honored to have you, ma'am. I hand over the session to you. Thank you, ma'am.
I think that also took a lot of time, so not taking too long, I think we'll get into the session requirements of today. Well, very glad to be a part of this roundtable, where we are specifically going to discuss on factors influencing sports performance and challenges in integrative rehabilitation. Well, before we begin the session, welcome all the panelists in this roundtable today, and very glad to have viewed your profile and really impressive profile each one carries. So just to introduce and welcome each of them here, let me just begin with introduction of our first panelist, Dr. Nandagopal, who's from Chennai, Tamil Nadu. He's the health coach, therapist and educator and a master trainer as well. So very glad to have you here, Dr. Nandagopal. We welcome you for this panel. Well, Dr. Nandagopal has a diverse range of degrees and certifications in yoga, therapy and fitness, and he holds a MSc degree in fitness, exercise, rehabilitation and nutritional care. So a very good mix of exercise physiology, nutrition, yoga and a lot more. So we are very keen to hear from him, as we are also very keen to receive some questions going forward. Next on the panel is Professor Usha Sujit Nair. Welcome to this panel. She's the Dean, Department of Sports Physiology, National Sports University, Imphal, Manipur. And she's currently serving as the officiating Vice Chancellor at National Sports University, Imphal in India. And she holds a doctorate in physical education. She has become a development committee member of the International Council of Sports Science and Physical Education. And she's had a lot of international accreditations and associations, and her significant impact on physical education is exemplified by her coordination with probably 6 passages of physical education and community coaching programs. So a lot more to hear on this field of physical education today, because we want students, at least who are in their undergrad levels, to look at physical education as one of the requirements is also going to enhance sports rehabilitation. Welcome you again. So next here on the panel is Dr. Hemant Kumar. So he comes from the field of Ayurveda and is presently the HOD of the Department of Surgery, which is called Shalya Tantra, at the National Institute of Ayurveda, Jaipur, Rajasthan, India. Welcome, Dr. Hemant. Thank you for being here. So he holds a BAMS and he has his master's in Shalya Tantra, which is surgery in Ayurveda, from the prestigious Banaras Hindu University in Varanasi, India. And he has about 25 years of teaching experience. So a lot to offer here in the surgical and parasurgical procedures. And I think you will also have some insights into what Ayurveda can offer, especially in surgical and parasurgical procedures in sports rehab. So look forward to hearing more from you. Thank you. Next here is Mr. Professor Diago. He is the CEO and Scientific Director, Dynamical Business and Science Society International, which is from Colombia, South America. So we welcome you here on this panel today. So he's a very active researcher with a strong background in molecular biology and biomedicine. So we have people from very diversified backgrounds, and that makes the panel very special today. And he's a very passionate person who has brought in a lot of adaptive processes and complex biological systems within various health and disease contexts. And being a larger organization, his organization is dedicated to research and business development in sports science, physical exercise, and health. So welcome you once again, Professor Diago. Yeah. And we have Dr. Mark King on to the extreme left here. He is the Professor of Sports Biomechanics, the School of Sport, Exercise and Health Sciences, Loughborough University, United Kingdom. Welcome you, Dr. Mark King. Proficient experience as well of 20 years, covering a broad range of cricket areas, from power hitting and batting, optimal performance in spin bowling, through an optimal pitch length for junior cricketers, and optimizing fast bowling performance, minimizing injury risk. Lots into sports rehab, lot to hear from all of them. So welcome once again, all 5 of you for this panel. So we look forward to a wonderful, educative, disseminating session today, as we just take off the session, where we are going to discuss more about factors influencing sports performance and challenges in integrative rehab. So I think all of you had the agenda shared as well. We'll take off the first 5 minutes, where each speaker is going to just give their thoughts on the specific subject area of their contribution or the expertise they have, the contribution from there on into sports rehabilitation. Followed by that, we'll have some question answers, and then we'll slowly get into the closing remarks. That's the flow of the roundtable today for the next probably 1 to 1.5 hours. So I'll request Mr. Nandagopal to probably take 5 minutes and share your views on how you have contributed, or based on your expertise has contributed to sports rehabilitation.
I'm happy to stand here. Really sincere thanks to Almighty, our university, our Guruji, and faculty, and special thanks to Sridevi ma'am also. So my contribute for our country. I'm the international certified trainer in yoga, fitness and Thai sports therapy. I just took part for Indian cricket team and IPL teams and internationals, Australia, New Zealand's cricket team. I'm traveled with a lot of international teams. It's only based on our Indian traditionals, yoga and recovery therapy. This my contribute for recovery therapy is called traditional Thai sports massage. This is based on the yoga sports therapy. It's like a sense line therapy, other names called everything is this. Your yoga is the 5 compounds, same like the Panchabhutas. Proper exercise called asanas, proper breathing exercise called pranayama, proper relaxation technique shavasana and makarasana, proper positive things called meditation, proper diet called sattvic diet. Same thing in 5 compounds in fitness: flexibility training, strength training, cardiovascular training, balance training and coordination training. So everything based on this, all things go to based on the prana only. It's a long breath, long life. Short breath, short life. What is that? Long breath. So increase the prana energizing. That is recovery therapy. The Rehab we using for sense line therapy. This is main motto for 3 things. This is founder of our Hatha Yoga is like a Patanjali, same like founder of our Indian yogi Kumarapati Shivako. He is the very close friend for Buddha, Lord Buddha. You know the lamas that travel with on the mountain, that muscle will fatigue, muscle soreness, calf muscle pullings, Achilles tendon, everything is very tightness. The lamas, they creating this kind of Thai traditional massage is very useful for recovery therapy. That 2,500 years back this therapy started, that based on the yoga, Hatha Yoga, acupressure, yoga, meditation, everything covered. This client on the lie down on Shavasana and Makarasana using the feet, 72,000 nervous end line our feet and palms only. Is like a work like a the traditional method way. You don't use for stretchings, flexibility increases. Main motto for 3 things. One is the flexibility, the range of movement increases. I am stretched like this, my range of movement is like this. Other one will push, little bit increases. Stuff joints should be loosening. The 3 circulations most important for our human body. One is the blood circulation, second one is the air circulation, third one is the body temperatures. This therapy giving for 3 circulation increases, range of movement, flexibility, relaxation and energy balance. What you eat, good food, nutrition food, you do for a lot of exercise, or everything will do, but end of the day, energy flow is must. The reason is, lot of doing high intensity workout, any kind of high intensity workouts, muscles should be more soreness, muscle tightness will come. If your recovery therapy will help lot of energy flow. That is the main motto for 3 things. So I hope this therapy is the 2,500 years back. I am the one of the master trainer in India. Total master trainer is 6 persons in India. I am proud to say this is combo for the yoga with fitness, all recovery therapy. So I am really happy to share this therapy for throughout the world, certification course, international diploma course. There are many benefits of this, my client, based on the international Sachin, Dhoni, especially Rahul Dravid sir, all work with the international celebrity, this therapy. Thank you once again. I hope the youngsters, the student, I'm saying the future, India, you learn yoga and therapy. Recovery therapy is the most important for yoga people also, not only for skill-related fitness, health-related fitness also you need this therapy. Thank you once again. Thank you very much.
Thank you very much for your insightful words and really appreciate the time effort as well. So I request Dr. Usha to say a few words on how physical education is a very special area and how you've contributed to integrative sports rehab.
Most respected chairperson, ma'am, I'd like to speak from the female athlete's point of view. Since my area is in exercise physiology, with the female, often female thought as a weaker sex, and there are a lot of issues which have come up. I could start with the menarche, because during my time it used to be 15 and 16 years, now it's come down to about 10 years. And I think below that, and research studies have quoted that early menarche is not a normal menarche. These girls who have early menarche have a high risk for breast cancer. So what we did was we have the pay and play scheme where children come in, and we tried finding out their age of menarche. We found that those children who were active, they still had the age of around 12 and 13, which was, I think, quite remarkable. And it's a change that physical activities does bring about an effect. That was one aspect of it. The second one, she grows up. One of the major challenges these days with the youth among the females is looking slim and beautiful. I think earlier Madam in Sports Nutrition had mentioned about it. I gave a talk because I was in Kerala. I think every day you'd find one of the talk in the schools or colleges. I find these girls, they would like to look beautiful, thinking that they don't eat anything and they're slim. And some of them, I think you can't see the waistline itself to that level. So their body gets crippled. So I'd often say that you're good to be kept in showcases. But these girls at a later stage, once they get married, often the problem is with conceiving. It's one of the major issues which has come up with. So I think in all this case, the low energy availability is one of the major causes, the chain of reactions which happens with the female athlete triad, which was already discussed earlier, especially with low energy availability, and which can affect the bone strength, and finally with menopause, early menopause. And I think the issues are immense. There are a lot of studies because we often see only outside without understanding what it is. It's important that the doctors need to understand that. And if you just elevate the energy level itself, I'm sure the hormone imbalance would be less. And we talk of a primary amenorrhea where the female doesn't attain by 15, but we also have something known as a secondary amenorrhea. I'd like to say this was the first study which I did my master's, and this was in the year 1982, which I did my master's. I could hardly find any studies for reference, but later I came to know that a number of cross-country runners having skipped their menstrual cycle for 2 years or so. So I think it's quite common now we come across. So it's very clear that once the energy, the activity load tends to decline and the energy tends to increase, it's possible to normalize. But remember, secondary amenorrhea can have long-lasting damages. So most of the athletes has come across, since I was with the Sports Authority of India, endurance runners, the coaches tell them, you need to keep your weight low, you don't need to eat. So I remember some of them, I tell them, I think you will get crippled if you go like this. But it's the demand of the sport. If you happen, look at a long distance runner and a sprinter. So I found most of these athletes doing this at the cost of their health. So I think when it is coming to sport, many of the time they compromise the health aspect of it. So I think issues are ample, and with menopause. Like I am also into fitness, and I believe that loading of the bones, and especially the risk of fracture is much more among the women with menopause. So how is it possible to bring about an increase in the bone loading along with the diet which is required? So I think it's very much needed for the women health, because I find all those sitting here, what's going to happen to you another 5 years, 10 years, 15 years, 20 years from now? So I think it's important for us. It's not outline look which matters. I think internal, in terms of your health, heart. I'm sure again you have exercise, you do aerobic exercise, you can make a heart fit. So I think in every aspect of it, exercise does help. And I'm sure in all these aspects, nutrition plays a very important role. And I need to thank Madam for having given me this support. Thank you.
Thank you. Thank you. I think a very special area of interest, a lot of women, whether they're students, practitioners, we see a lot of women. So a lot of learning, and I think learning should continue. So we'll move on to the next panelist, who's Dr. Hemant Kumar. So just request you to share your words on the impact of Ayurveda, especially with your experience into sports rehab.
Thank you, madam. Om Dhanvantaraya Namaha, Om Manjunadaya Namaha. And good afternoon, all the dignitaries on the dais and off the dais, and my dear students. See, recently, I am basically Ayurvedic surgeon, practicing all general surgeries, lab, and some orthopedic procedures. Both ancient and present context we are practicing in National Institute of Ayurveda. And we have 3 units in our department. One is general surgery, specific, another thing anorectal, and number 3 is orthopedic, marma chikitsa and sports injuries, OPD and OT is there. See, usually what we observed last year back, 1 year back, we started MSc course in National Institute of Ayurveda, Jaipur. That is MSc Marmology and Sports Medicine. See, this department also, it comes under subunit of Shalyatantra surgery. And especially what we observed, especially for athletes and sportsmen, and performance of the sports is the manner in which sport participation is measured. Sports performance is a complex mixture of biomechanical function, emotional factors, and training techniques. When an athlete and the coach can isolate areas on which to focus in training, the ultimate result is likely to be improved. And some of the factors influencing sports performance in Ayurvedic perspective, like Prakriti, this is very important to assess for the sports personalities, like Prakriti, constitution, Agni, digestive power, Ahara, food, habits, Vihara, behavior, and Yogic asanas, Nidra, this is also very important, sleep, and Vadik Shamatva, Bala and Vadik Shamatva, that is strength and immunity of the personal, and Sattva. See, this is also very important for mind strength and psychological factors. And Desa, according to the place, the food habits and different, and Kala, time, and Vayas, age, and Vyayama, exercise, Satmiya, lifestyle and behavior, Ojas, and Rasana. These are some of the factors. We made some protocol in our institution to assess the each and every injured person or sports person that visited our institution. We have maintained a protocol, and especially in our institution, we have seen last 2 years maximum patients are coming from injury to the ligamentous complex, especially for the knee, like knee, ACL, PCL, like that, and ankle sprains, and especially inversion types, lateral ligament injuries, and like anterior talofibular ligament and calicinofibular ligament, posterior talofibular ligaments, like that, and sprains and strains of the spine, lumbosacral strain. See, these few factors we identified that, and we made some protocols. We made some protocol for the assessment of the patient and what protocol we can adopt onto the particular. I am giving one of the example. Anterior cruciate ligament. Anterior cruciate ligament, especially partial tear. I think we are using some protocol like Abhyanga. Abhyanga, we are using Dashamolthail twice day, for especially for target the muscle wasting in the quadriceps. And Patrapinda Sveda with Nirgundi Patra after Abhyanga, and twice daily for 20 minutes. And physiotherapy, especially standard quadriceps strengthening exercise daily, twice, and some oral medication. So many research works on Gandha Tela. It is available in the net, so many publications are there. This is a very strengthening for muscles and bones, vividly practicing this Gandha Tela. See, another important aspect we are practicing in our institution, I think everybody knows about plaster of Paris, that is gypsum, calcium sulfate. But we are using in place of plaster of Paris, plaster of India, that is Manjishta Dilepa. That is Manjishta Dilepa, and it is maximum last 20-25 years I conducted so many research works. It is available in the net, so many publications are there, both PG and projects and PhD research works. It is available in Susruta Samhita like Manjishta, Eshti Madhu, Satatota Gruta, Rakta Chandana, Shalipishti. See, we conducted the study of plaster of Paris with Manjishta Dilepa, and there is encouraging results in some of the hairline fractures. After reduction, we can go for Manjishta Dilepa in place of plaster of Paris. And especially we observed, we standardized this procedure, especially sprains, ankle sprains. inflammatory joints. If it is acute conditions, we are using this Manjishthadilepa in cold formation. If it is in chronic condition, we are in the hard formation. Like that, we are using this Manjishthadilepa. One of the important preparation we are using that. Like that, some of the protocols we prepared according to that. And thank you, madam.
Thank you very much. I think novel for all of you. So next panelist who can take his 5 minutes is Professor Diego. So open to you.
Hello to everyone. I would like to share 4 points that are maybe based on for me, that I consider a huge challenge in this area, that is standardization of the protocols or the methods of the assessments. And the first one, for example, is that we have been doing some research in cross-education. So, for example, after ACL reconstruction, we have been training the contralateral part to, improve some cortical changes in the brain and maintain even some strength-related variables. But that needs to continue being standardized, because we have found some conflicting results in some subjects. It depends on, as Dr. King was saying in his talk, by the individual factors that each person has. So cross-education is an interesting field. I guess that the near and the next research that we are performing on using functional MRI will just result in some hints as well, and add some other data. But it lacks of the standardization of the processes. There are many variables that we cannot control there. And also, the other important thing, just moving to this side of the rehab, is using virtual reality. Motor imagery, I don't know if you have or familiarized with that technique. It's a process where the people can use get in touch with a visual phenomenon. For example, a video of the people training biceps when they got an injury in the elbow, tendinitis, or maybe a fracture. And these brain changes that are taking place there are also a promising area of studying. And obviously I discussed this within a framework where it should be with proper nutrition, proper sleep, and the proper physical activity in the coming back to avoid resilience. But again, it's an upcoming tool and something that it's being tested in many labs. We have done that as well in our labs, and it's promising. But again, it's the true challenge there is standardizing. And moving from this side of the AI, because it's AI related, I like the way that Dr. King presented as what do a research, what do a postdoc, and what do finally the coach. And I guess that word that you use for profiling is also very interesting, and our task as well as coaches or as our researchers. We need to profile people. And in this part of the profiling methods, we have been using also unsupervised machine learning algorithms to do that. Obviously, clustering methods, there are a lot of them. Normally, people just stay in the basis, k-means, for example, but they don't go deep into the analysis of what is more suitable for your data. And again, that needs to be standardized for our topics and our variables. Things like reduction of dimensionality when you have vast amount of variables, and selecting the more accurate algorithm to classify and profile them. So those are interesting things that are coming for us, and that we need to be alphabetized in these topics, because otherwise we will fall in this the normal way that several people does it, that is this is a black box. I don't know what is inside, so I just input variables, and this is the outside, and I don't know what is happening there. So I guess that this needs we need to make some zoom in and to have some other standardized protocols for that. And finally, the interesting, for me, thing that I have been working in the last year is the allostatic load. That is something that I will present in my talk on Saturday. And it's about everything like measuring the stress is the thing, is that it's allostatic load. Actually, is the cost that the biological systems has to pay in order to adapt to a new level. So, but how do you measure that adaptation? And that is where comes in this integrative approach, because the allostatic load index arises as a measure of several components: cardiovascular, neuroendocrine, metabolic, and even psychometric variables that can just give us a better picture of what is happening in that person. So those are like key things. Again, it lacks standardization right now. Allostatic load has been maybe more studied in cardiovascular diseases and phenotypes of obese and where there are some risk of a stroke. But in our field, it's in infancy. So that is the thing that I wanted to share with you. Thank you.
Information, and I think we have futuristic questions coming up, so we'll have more to dwell as well. And so now request Dr. Mark to make his presentation.
Well, I guess you've already had my presentation. More about, I guess, if I focus around the injury risk area. So as a biomechanist, the key thing is understanding. And from an injury risk perspective, it's multifactorial. So performance is much easier than injuries. Injuries are much harder. And then Diego talked about standardization and data. And I think that's really critical here, because we have some understanding, but there's an awful lot more understanding needed for us to reduce injuries to as small as possible. And so profiling athletes on a regular basis to create a data set for the future where we can use AI and unsupervised learning, etc., to understand what's happening so that we can hopefully reduce the risk of injury. And from my perspective as a biomechanist, that's from a technique perspective. There's lots of challenges. We're in the era of so much data. We've seen in presentations, I just went to the biomechanics session earlier about using pose estimation, and we can see so much information on every single performance an athlete does now. The danger is we get data overload, and we don't know what's the important data and what's just the noise or the data that's not that important. And so we're in an era now of really trying to quantify what's the right information we need on athletes so that we can then put that into our models and open the door on the black box and understand what's inside, and then understand what's going on, and hopefully then reduce injuries in the future. So that would be my points at this point.
Yeah, thank you. From everyone, because you will gain a lot of insights when each of them talk from their experience and field of expertise. Well, just moving ahead, we always know that there's a big mind-body connect when we treat an individual. And especially today, we are at S-VYASA, so we have to talk a lot about yoga, Ayurveda, naturopathy, which are all very much Indian systems of medicine, and all of them talk about the mind-body well-being, which is an extremely important subject. And all of you will definitely not disagree if I say it's an extremely important aspect for sports, and whether it's recreational sports or it's professional sports as well. So let's begin with maybe just brief discussion where I'll just open questions to each of you on factors influencing sports. So when we evaluate these factors, we know that we have one controlling organ of the body, which is the brain. A lot of it happens from here. Yes, we talk about mind, but it's not something which is perceivable in terms of understanding it as an organ, but that's a different experience which the Indian systems talk about a lot. So looking at this aspect, emotional intelligence, confidence, attention, and cognitive reappraisal, these are some very, very important factors for sports personnel. So when we look at these, I probably request each one of you to share your opinion, and let's specifically address this aspect: emotional intelligence, confidence, attention, and cognitive reappraisal. So each of you have a different diversified experience So you talk about physiology, psychophysiology, talk about female health in terms of sports, physical education, and a lot more. So just please bring in your own perspectives. And if somebody has already mentioned, probably you'll have to take up some other aspect and talk and not repeat. That's a humble request. So we'll start with Professor Diago.
Yeah, that's, I guess, a target that we all have. Try to mix the quantitative part, the data, the clinical data that we are measuring with machines, with this subjectivism that has to know the exercise, for example, the perceived exertion effort, or to know, as you were saying, the emotional and some other pillars of well-being. And I have to say that we have been working on well-being, but in undergraduate students, and standardizing an instrument that it's based on the PERMA +4. The PERMA was a model that was proposed on positive emotions, engagement, relationships, meaning, and achievement of a person. So we developed a scale, like a 0 to 10, where the students can use, classify or score in one of those domains. The other 4 are physical activity and some other factors more related to environmental part. But I guess that this transition of having these well-being tests, it could be that one, or it could be, if we are talking of mental toughness, or a dinner scale, or many others that exist. Again, we need to, because there are many tools, and as Dr. King was saying, there are many data there, many tests. Which one are you going to use? So why are you selecting that data? Is valid for your population? It has been tested before. So, and then we can just try to put all of that into a realization of in the athlete, because I guess that the truth is that they think different than us. And if we are researchers, we are expecting and trying to make all the constructs, the internal validity, the consistency of the instrument. But there is a very tough task to just to...
Yeah, yes, just to interrupt here. The genetic predisposition to these factors, being from the field of molecular biology, I think you should also mention this. What's the genetic predisposition which an athlete would have into all this?
There are some single nucleotide polymorphisms for some conditions related to neurotransmitters signaling, but there are the most important are the environmental factors that affect not like a direct mutation, but in this case, these epigenetic changes. So methylation and some other acetylation of histones, for example, are many of these processes that take place in the athlete after he has, let's say, in an example, an injury. The changes that occur, the kinophobia, the many factors that influence the way that he is going to, again, respond to the reality or to the distal physiology, it's affected by gene expression, as you said. So that is the core. But the true in this scenario is to try to mix these genetic factors or the molecular factors with the things that we see in the physiology, in the macro world.
Right, thank you. So, epigenetics, as you mentioned, and when we look at it, even in Ayurveda yoga, we talk a lot about how the influence of epigenetics is. And looking at this, manas and buddhi are two aspects which Ayurveda describes a lot, and this concept is highly deep-rooted. So, how do you think all this influences emotional intelligence, confidence, attention, or cognitive appraisal? So, your take on this, Dr. Hemant?
See, already I mentioned previously the factors influencing performance. These are very important in Ayurvedic perspective, like Prakriti, Agni, Ahara, Vihara, Nidra, Bala, Sattva. And especially the Sattva, the mind strength. So this is a very important factor. Sattva is mental strength or psychological well-being, increase the immune response and enhance resistance towards diseases. This is very important. The immune response depends upon the psychological status of the individual. The individual, there is psychological status different. And already, you know, according to Ayurveda, there are 3 gunas, sattva, raja and tama. There is a 3 types of gunas. This integral component of the mind and energy requirement for the creation. See, this is most important. And especially the mental characteristics of individuals that determine the predominance of one or any other gunas. You maintain the balance between sattva, raja and tama. And especially sattva of the human being is significant to maintain the homeostasis within the body. See, another factor, very important, they mentioned is rasayana aspect. Rasayana is one of the important branch of Ayurveda that deals with the enhanced quality of life and extend the lifespan.
We will come to that.
Yes.
We have some questions there.
Yes,
so, Dr. King, your perspective here?
I guess I've got 2 points I would make here. So from a biomechanical perspective, there's a lot of unknown still around how people learn. So if I understand what are the factors that are technical factors that are linked to a good performance, that doesn't mean everybody can just do them. And so different personality types and different confidence levels, etc., equates to how people learn those different skills. So there's a whole area of motor control there to be further explored in the future. And then secondly, from my more mathematical side of my work, there are some techniques that lead to similar outcomes that are more robust to noise and perturbations. And athletes don't necessarily know whether they're picking a good technique, which means under pressure they can still perform that technique well and achieve a good outcome, or is their technique on the edge and it's likely to fail under pressure. And so biomechanics can bring an understanding there to that as well. But those would be my 2 areas that I would mention, one around motor control and one around robustness to perturbations.
Great, thank you. So moving on, probably I'll post a different question to Professor Usha and Dr. Nandagopal. So let's specifically look at physiological factors. So when you look at physiological factors, physical conditioning, you know, hormonal changes, Dr. Usha just touched upon that. But let's take a step ahead and then concentrating maybe especially in female, physical conditioning is a lot more challenging aspect. But let's not keep away the male, but let's be inclusive, but let's throw more insights into this. Maybe Dr. Usha, would you like to go first?
You brought in from the physiological perspective and with the female you mentioned, because from physiology I think I thought like you had mentioned of the cognitive and the confidence level because you mentioned earlier, but in terms of the physiology I think there are certain biomarkers which maybe depending on the level of exercise, when you have a strenuous exercise, the biomarkers are the ones which will maybe in terms of the cortisol levels, and the other biomarkers are the ones which would tell us the extent to which a damage could be there and where we could put in. But I'd like to make a special mention of cognition, because with recent what we did with was women, a number of studies are limited in terms of cognitive abilities, especially physiology we do all below to the brain was compared to lesser, the effect of exercise and bodily movement. And we found that definitely there's a lot of impact of physical exercise on the cognition, and especially with the elderly women, now around 20 women who want to, actually I'm into aerobics. I found them, like, ask them to have alternate legs moving, and they say, this is brain exercise. The first thing they say is brain. They're able to comprehend things, they're able to memorize things. So I found the physical activity, there's a lot of these changes which they are experiencing. And then I make them speak up. So I think certain things are which are practically which I came up with. But in terms of physiology, I'd like to say one of the most important terms of performance is fatigue, I'd like to speak about. Because what the fatigue would start from the brain down to the contractile elements as such. But definitely through yoga and the other aspects which you have here, what would be a possible thing? Because in terms of either is it because of lactic acid accumulation, most of them have a myth that anything you ask what is the cause of fatigue, they would say it's lactic acid without realizing it's just, if it's anaerobic glycolysis only, then the end product would be lactic, which most of them are not aware of. But I think as today morning somebody mentioned in the session, just following exercise. There need to be a slow limbering down. What is the purpose of limbering down? Is to recycle the lactic acid, and then what is the purpose of stretching? And stretching, this is where yoga comes up. I very much agree with what Doctor mentioned earlier, was with regard, is it possible to measure the stress? How do we do cooling down in our exercises? Often we find we generalize it. If we talk of a football match or any game, the stress onto special muscle, if we can measure that, and we find those which really needs it, then we find this, we are quantifying it. But here, for most of the time, we are generalizing it. So I think this is certain things, and the injury could be actually be minimized. Talk of a badminton player, tennis players in terms of cooling down. They'd spend a very good amount of time. They would not bother where they do it. But for the others, I find they don't understand what the body is. So I think it's very important of body and mind, because you're not simply, you're not a robot, you're not a machine or a product. I think when a movement is taking place, it's very important to understand that. So, and that, I think, when you talk of domes, which you can minimize that kind of a risk. So I think which is quite less, and I always would tell my students that the attendance to the rehab could be minimized if you can actually do a proper stretching and the cooling down, which most of the time I think that could be minimized from injuries. Anyway, thanks, ma'am.
Thank you. So I think it's very important that they also warm up and cool down, and it's just not professional sports, but when we see them at clinics, people who are in recreational sports now, I think they're also getting into a lot of injuries because of a lot of ignorance in the public domain. So I think as students, it's also your responsibility to share this knowledge to people whom you come across, so that we educate people, in the society. So Dr. Nandagopal?
Yes, Dr. Usha says 100% truth. Basically, athlete preparing for the pre-seasons workouts. One is the off-season, second one is the middle season, third one is the peak season. The peak seasons only is more tension and physiological changes will come, cortisol, imbalance, muscle fatigue, everything like a peak season, because not only for physical aspect, it is mentally the disturbance for that competition worries, everything will dominate. But actually as a coach, the preparing for the training methodology, including that train to the 5 koshas, if the yoga says no, Annamaya kosha, Pranamaya kosha, Manonmaya kosha, Vinyanamaya and Anandamaya. This is implement for this sports technical aspect, because Annamaya is focusing for good exercise, good nutrition food, good relaxation techniques. Annamaya is the basic, the physical type of activities. Pranamaya is the breathing techniques and kriyas. Proper breathing exercise and kriyas is the increase your cortisol imbalance, is reduce the imbalance. Then Manonmaya call mind body, that is needs for pratana and meditation. Vinyanamaya technical aspects, intellectual techniques, training methodology will use. European style is 5 compounds: cardio, strength, meditations, yoga and massage. But here our Indians, that training, that year fully they will walking, only the walking, they're doing for continuous walking only. The strength training only that use for regularly gym training. But our training methodology slowly will focus for 5 compounds. Flexibility training is must, either yoga or stretching exercise. Mind training is must, pratana or meditation, or breathing techniques, pranayama or kriya. Kriya is just toxin, how to reduce your toxin. So emotional toxin. So physically, mentally, emotional changes will come. So this methodology, all changes will help you, the athletes and general population also. Thank you.
Yeah, I think the summary here is we have to achieve mind-body balance, physiological and psychological balance indeed. Use different, detox methods like you just mentioned, what yoga offers. You can also bring in a lot of other methodologies, right from sports training to yoga and many more. Well, I think the most inquisitive part from the audience would be to talk more about diet. So I think we cannot leave this forum without talking about diet, and that's why it's right in between the session. When we talk about diet, a lot of fads, a lot of myths, a lot of fallacies, all of us know that. The first thing on top will be protein supplements. So not more to say, but what is right, what is wrong is something which we can debate, but I think it's more about perspectives. Each one of you can probably share on diet perspectives, Is non-vegetarian diet the only way of getting in protein? Is the protein supplementation the only way? Lot more. So I think you can just share your views. We can just get on to the flow. Would you like to start, Dr. King?
I'm certainly not an expert on diet, and our friend over here from this morning, if I say anything, she'd probably say I'm wrong. My own perspective is I've never particularly used supplements myself as a player, but I just believed in a good balanced diet, and that was my philosophy on things. So that's all I've got to say on that.
I need to start saying that I have conflict of interest because I work for Creapure, the German creatine producers of creatine monohydrate. But actually, okay, you might look for it, don't believe me, no? But it's the most studied and the ones who has been used for all the clinical trials since 1992 in the first clinical trial by Dr. Roger Harris. So I have to say that in this industry of dietary supplements, the most important thing is quality. Because we are, as already Gita mentioned it, we are facing these fraudulent products, labels that don't have what they say in the label. It says a given amount of protein when the method that is used is Keldal, that at the end of the measure is total nitrogen, not protein. So they play with these kind of tricks just to add some amino compounds, and with that you raise your amount of protein. So that is starting from that. We need to educate people and practitioners on this so they can identify different products. For that, there are third-party organizations that give us some quality seals, as Gita also showed us, BCAG, NSF, Informed Choice, Informed Sport, and several others. But also about the type of nutrient that we are using. Because actually Dr. Ronald Maugan, who maybe don't know, is one of the most recognized researchers in nutrition from the International Olympic Committee. And they came with a new paper the last year with a proposal that it was like sort of revolutionary, because the title was saying like food first, but not always food. And that is a very good paper that I recommend to all of you, because they extend with several other authors key points where maybe the food only will not be a full approach for an athlete. For example, beta-alanine or creatine, they cannot be given in the required amount for the ergogenic aid or the results that they have. Used for food. You will need to intake like 1 kilo of flesh or beef to have like 3 or 5 grams of creatine. And we are now, since I invite you to all to follow Creatine for Health, it's a big initiative that we have with several other creatine researchers in the world. And we know the benefits that it has beyond its performance for health, for depression, for several other treatments like sarcopenia. So I guess that the thing there is the quality of the product, and with that, I forgot it. Just another example that for the cases, it's a good one. Ashwagandha, Bitania somnifera. No, we all know that here in India you use it. It's part of the Ravatasam. You correct me if I'm wrong. But it's a part of the Ayurveda that can also helps to reduce stress levels and anxiety. And we actually did a meta-analysis, a Bayesian meta-analysis, and we concluded that with a sort of limited and heterogeneous evidence that it has some potential to improve performance. But the bad thing is that, again, which ashwagandha are you using? Do you know KSM 66, who is the most recognized and standardized with some withanolide concentrations that we are aware of what is the amount of what you are taking, or you are using a different product that you don't know what you are taking. So I guess that is the true thing.
Yeah, so but we I think have to concentrate on what we otherwise know as holistic nutrition, and which has to be balanced, and there are a lot many things in it. So do you think that supplements are needed when it comes to sports personnel, especially females?
Yes, ma'am, because depending on, as you said, vegetarian, non-veg, as a recreational athlete or just, I mean, it's okay, but otherwise, as rightly pointed out. But now the problem coming in is, now what we say is, it's being exploited or misused. For instance, if you take something and you get the result within a week, they take double, triple. And that's how, in terms of doping, people don't realize what it is. They don't realize what the consequences are. So at times, as you said, secondary products, if you get certain things where you get one free, people go for it. So I think it's a very important thing, labeling, and who's going to check for the standardized. I was there once when I was in Trivandrum for the children, had a school competition where these supplements were being sold for children. And these people just come to see where they can make it a business. So I think many a time, people are not checking. So to what, and now children are doing without the knowledge of the parents. So in India, things aren't going smooth because when we find something is good, it's going in. But I think without supplements, it's not possible. But it's important that we need to come up, like you said, in terms of a certain guidelines or strict framework where a legal thing, once it's brought in, it's very much needed. Even with the sports person, everyone is given a particular amount for the supplements. And at times you find them using it for cosmetics and other purpose than keep using it for this. But I'd always suggest that let us go through the rich, the natural source, which India's got such a rich culture where you have in, like as I was here seeing something with moringa and things. I mean, whatever it is, I think we are going in for products from westernized. Why don't we tap the resources that we have within ourselves? I'm sure the opportunities are huge, but I think without supplements, I would say no for a sports person. It's not possible. Thank you.
So it's always important that you have personalized nutrition. So as a health coach, what would you say, Dr. Nandagopal?
Actually, nowadays all are using for supplement. They don't know what inside or anything, but everyone says like a mind related. They think if you eat for supplement, your performance is high. But natural way approaching is ideal one for that. Natural way for either veg or non-veg, that is not an issue. But yoga says for three things. Hari, avoid three things. Hari, ori, curry. Hariness, oriness. Curry means deep fried. But if you are seafoods, a lot of natural proteins there. If you don't want for, you are vegetarians, it's like a spirulina, ashwagandha, it's a lot of energizing food. This Ayurveda is like, many things is there. But nowadays, this ma'am says correct, Usha ma'am, the Geeta ma'am says morning sports nutrition also. He explain more for protein diets. Natural way approach is the ideal one. The short time, short performance only, their expectation for doping or quick result they need, they're taking for it's unstandard, non-standard proteins and all. But later on they will suffer. If you are the 20 years basement of workout, next 40 years what you are did for that school and college time. Then 40 years what you are living lifestyle for under the next for 60 years. But it's what you are eat, how many, this is not a quantity, is not matter, quality. This you learn for what you eat, everyone know. But how to eat, this and all is methodology. So dietitian, physicians is consulted with it. Randomly they don't take for protein diet, but unfortunately now sports people's all taking for proteins, supplement like that. Thank you.
Since I was, as I said, with the sports and from Kerala, we tried around maybe 25 years back with something known as Arogya Pacha, this a particular leaf when they used to. And we tried with us in our university. And then our faculty was against how are you trying and experimenting even though it came in. And the allopathy doctors were totally against it when it came to, they said you can't take in. Now ashwagandha is something, because we had a collaboration with the Ayurveda College. We do have in our institute an Ayurveda and the allopathy, the medical unit, where the students take in both. I mean, we have that kind for the sports medicine aspect. But I found many a time they would say, even if it is an Ayurveda, they would often say, how do you say it cannot be considered a doping agent? So one of the most important is labeling in terms of identifying whatever you take in, just to check, because the career of an athlete could be at stake if things are not. Thank you, ma'am.
That's very true, but when it comes to Ayurveda, I think what Ayurveda also talks about is not based on nutritional value or calorific value as nutrition, modern nutrition talks about. So I think it's very important for the audience to understand Ayurvedic perspective of guna when it comes to ahara.
Actually, in Ayurveda, they given a maximum importance ahara. See, whatever the food you are taken, there is a two important Shaktis, that is called power. Abhavarna Shakti, Jarana Shakti. That means which quantity of food which can be eaten can be digestion. So that is most important. Another very important is proper food, that is called quality food. And proper quantity at proper time. These three important factors in Ayurveda they mentioned. Quality, quantity and time. It touches the power of strength and increases the immunity of the body. One. Another important Ayurvedic mentioned about balanced diet. Balanced diet, they mentioned that is Shat Rasas, that is 6 major tastes are there. Like sweet, sour, salt, pungent, bitter, astringent. These are in balanced diet, then it will increase the strength of the person, and especially sport person, you can maintain this balanced diet, we can be healthy and live longer without any risk of diseases. And so many, not a question of vegetarians and non-vegetarians, and so many, in Ayurvedic also they mentioned so many vegetarian diet and non-vegetarian diet according to Prakriti and Sattva. Thank you.
And now I think everybody knows, because Indians are very much fans of cricket. So Virat Kohli is vegan. So there are many things like this. So people can get motivated to stay healthy, fit by the right diet. You don't have to bifurcate and call yourself. It's your belief system, and experts are there to help you. So don't resort to YouTube videos or just WhatsApp forwards and just get on to diet, especially if you're a recreational sports person, because I think serious sports person do consult doctors or experts in the field. Well, when we look at the influencing factors, one last question I would take up before we address the challenges in integrative sports rehab is on use of technology. So a very important aspect now, mobile technology, or you talk about anything like sports bracelets and a lot more. So biomechanics, I think you use a lot of technology. Would like to hear from you, Dr. King.
Yeah, I mean, I alluded to it earlier that data and technology is the world we live in now. And it doesn't necessarily mean we understand how to use that data and technology to its best. I think we're on a very fast learning curve. 20 years ago or 30 years ago, more than 30 years ago, when I started as an academic, these didn't exist. And now they do, and these are much more powerful than anything I had 30 years ago. And the challenge is, how do we use that technology in the wisest and the best way? There's so much on YouTube, for example, and people copy, and there's great examples of people, who haven't got access to good coaching and that learning off YouTube. But there's a better way than that, and hopefully I tried to allude to some of that this morning. But there's an awful lot more understanding needed to say, how do different people learn with different learning styles and understand, etc. So yeah, there's a danger of data overload in this next period.
The era of AI and ML, what's your take there?
Yeah. For example, I work as a kinanthropometrist. I do certifications for people who is interested in doing and using skin folds or gears and many other measures in the body. Not only for body composition, but also for morphology analysis, performance, efficiency of the movement. And this is going to be replaced by the digital anthropometry. This is something that I already discussed with the president of the ISAC. And we are working in many projects within ISAC just to standardize those digital anthropometry methods. Because in the near future, it's very similar to these dots that you saw in the pictures of Dr. King. Just with that, you can reconstruct a 2D or 3D avatar of a person and monitor changes in body composition. And also estimate the gear, for example, of the waist or the hips or many others that we use for clinical purposes. So the interesting thing there is that it's going to be faster and cheaper for being accessible to whole community. So I found it very something that it's going to happen, is unavoidable, and actually I remember the last 2 years ago was I participated in that Delphi exercise for the Futures for Europe, it's called. I guess that maybe Dr. Kina has seen that. It's like some surveys that they are using to like the way that we can face some upcoming challenges and risks. And one of those, the domain of artificial intelligence, is one that it's a fear for many. Because nowadays we are talking in something that is called a general AI, because it's something that we can use and we can control. But the issue is when it turns into a SAI, a super artificial intelligence, and that is the thing with the movies and Terminator and that stuff that people start using analogies, but that it's something that can create some fear, because which is going to control your money in the banks or your data, the privacy, where is going to be the ethics and the moral of that. So it's going to be a challenging part in the next years.
So as a physical education expert, Professor Usha, so I think I just request you to also give some information to students, especially, of how they can bring in technology when they want to enhance their sports skills. Not necessarily they have to be into professional sports. So do you have any insights here?
When we discuss with physical education, we are also into sports sciences like sports biomechanics, sports psychology, sports nutrition. And now the ministry is very keen in, since we are with the Ministry of Youth and Sports, we are the only university in India. And we are also improvising, trying to equip ourselves. So in terms of sports psychology, without technology, no. So we are going with technology, and we expect the next Olympics to be in India, and India is heading for it. India is well preparing for it, and at every stage, India is doing very well in the other streams in terms of technology. But in terms of sports, we are collaborating and trying, especially from sports biomechanics. I think once that application comes in, many of the things what are in the field would change. Things would change because the athlete themselves can see how it is. So even as a physical education, it's actually preparation for an athlete. So I think in all this case, without technology, I say no, and definitely we are doing it ahead, and we need it. And without that, we can't progress, because we cannot say that when it's an Olympics or any international competition, it is same for everyone. It's just because of lack of something, maybe in terms of surface, maybe in terms of the training gadgets. Talk of anything, I think without technology, we don't stand. So I think, but as you said, if you would come tomorrow, you'd have people like Roberts, people would have prepared Olympians. So I think like you are jockeys now today, this is what the future could be. Oh no. Thank you, ma'am.
Yeah, but I think good round of applause to say that India is preparing for Olympics. Yeah. So as an Ayurveda expert, has something in Ayurveda been integrated with technology in sports or anything in this area?
Definitely the technology is needed. That is, definitely there is a technology, there is both advantage and disadvantages are there. But the implementation of the technology is very needed in sports medicine. And especially you have seen that athletics and everything, we are using GPS technology and say different technology to assess the status of the patient and personal improvement of the athletic or any sportsman. Definitely it is needed.
Have you given any suggestions to sportsmen about usage of some gadgets? Maybe you can name some, and if somebody wants to use, they would like to.
Sorry?
No, as a health coach, probably you would have suggested sports personnel to use some gadgets or technology-based interventions. Anything you suggest? You want to talk about anything?
No.
Nothing on that. Okay. So
actually nowadays, technology-wise improvement lot for the physical education background. I'm the basically athlete in a school and college time for 800 middle distance athlete. But nowadays, it's a lot of improvement in India, especially for Fit India, Kilo Games, all comes to a lot of athletes will increase a lot of performance, more performance, synthetic tracks. So advantage level is more. Our Sports Authority of India doing lot of work in our society.
So I think everybody is very excited about the progress made in the country as well, and we're also having experts from other countries to add on to what India is also gearing up, and we have student representatives who are going to become definitely the future of the country. Well, going ahead, let's also address the challenges in integrative rehab. But here I want to first, define what integrative medicine I'm talking about with the perspective of being inclusive to a multidisciplinary approach, which includes yoga, Ayurveda, naturopathy, which includes acupuncture here in India, and conventional medicine and physiotherapy. So when you look at a rehab unit like this, and there is a rehab unit which is just at its soft launch here in the university campus, and we're going to have a extensively well set up integrative sports rehab complex here at the university as well. So when you're looking at this, what kind of inclusivity we have to bring in, what kind of protocols probably we need to also talk about, and how do we see that each discipline complements. See, where I'm coming from is there's somebody who comes in, so maybe a doctor here is an Ayurveda expert, so he pitches only Ayurveda and a lot of it there. Instead of that, we bring in the holistic perspective and bring in physiotherapy, yoga, we begin sports biomechanics, sports science concepts. So each individual with different experience has to contribute. Now that's where integrative medicine stands. Not by personal choice, but it's by bringing the person-centric approach, which is very important. And here when we talk about personalized medicine, so I just want all of you to share your insights on this and how we can bring in this person-centered care to into sports rehabilitation, and your best thoughts here. Dr. King?
So in the UK, we talk about having a multidisciplinary team that works with elite athletes, where you have your physiologist, your psychologist, your biomechanist, etc., working together. But that's only really available for the high end with very elite athletes. At the lower end, you tend to go to a physio if you've got a sore joint, etc., and it's still very much in isolation. I think going forwards, when we think about AI and machine learning, that opens the door to having more personalized rehabilitation for the recreational and average athlete that's at the moment is only available to the very elite. And I see that's where there being a big change going forwards.
Diego?
I was thinking that in this part of the integrative rehab, as you said, the prior knowledge of the professional is going to also bias what would be the treatment. Now, if I'm, for example, a keto lover and I love ketogenic diets, I'm going to give ketogenic diets to all my clients. And that is something that we as professionals, we need to combat to that inner bias that we have. And the best way to act in this scenario is to use evidence-based practices. Because with evidence-based practices, we have what is consensus in the community, in the international community, what is recommended in certain cases, and after this application of the first protocols, we can just individualize with several of these alternative treatments as well that they have been proven to work in some scenarios as well. For example, in two cases, one is that the World Health Organization includes acupuncture also as another strategy to treat certain diseases and certain conditions. So the door is not closed. And also we publish a paper also using or evaluating the effects of acupuncture on sports recovery after injury, and it's promising as well. So I might not say that it 100% sure that it works, because it needs, again, good training, the people who is doing the application, and that it's transferred in the correct way. And with that, if we can ensure that part, we can just use it as another tool. But I guess that the evidence-based practices are the key, and we have this task in this case for using these kind of evidence-based practices, but in alternative medicine, because you have very good tools actually in Ayurveda. I have seen several awesome databases with a lot of information, not only here in India, but also in Chinese. Some other compounds that they have, even a lot of those herbs as well, and that they can use with the bioinformatics to, for example, tackle or target several proteins, and it has been tested with very good and promising results. So I guess that it's joint efforts to standardize, reach the consensus, and that people can use the correct protocols.
Yeah, task force I think becomes very essential to bring in this multidisciplinary approach, and I think each member of the task force has to understand what the other discipline can offer. So understanding the strength and weaknesses of each discipline will play a very crucial role in this. So well, going ahead, your piece of advice or suggestion on the same?
I truly said that is multidisciplinary coordination is very needed. So not only yoga and Ayurveda, physiotherapists, nutritionists and psychologists. So this total collaboration is needed. Another very challenge is individualized treatment plans. I can to design the treatment plan according to, based on the athletic specific needs and injuries. That specific treatment plan you can design. And some psychological factors that are very important, challenging integrative, that is especially for mental and emotional aspects of injury recovery, such as fear of re-injury or maybe loss of confidence. This must to build, I think. Another very important, resource limitations. Why? Because availability of advanced rehabilitation equipment and facilities and expertise. This is also some of the challenges for integrative rehabilitation.
Very true. I think when it comes to the setup or the whole setup which is needed for a rehab unit, how do you think each institution should work, and probably you will have your own challenges?
I could just say from the experience point of view, because for the last Commonwealth in India, we did have the Ayurveda unit along with the allopathy. But what I find is, as rightly pointed out, to have an understanding, it's again the choice of the individual athlete. How quick he can recover, come back, because return to sport is more important. I can understand where you have enough of time, then there is a recovery process different, where even to conduct a study in terms of Ayurveda, because I have been one of the co-guides in the Ayurveda too. But when I had found, I said, bring in the similar cases of the allopathy plus the Ayurveda to know how it works. Many a time it becomes very difficult. So I mean, it's important that we all sit together and bring up, and it's important that we need to give importance to our system of medication. But again, it's a choice, and like we did in Trivandrum, what we have is athletes, what they do, for any initial, they go to the allopathy. After that, they come to the Ayurveda. So they take in both. So even they have the records, this is what they do, because you get oil for massage or whatever things are there. So many a time, they are unaware of what it is. So first is, I find is, if you can bring the coaches, get the confidence of coaches, have a meeting trying to bring about such changes. If you want to bring in a major aspect is the doctor from the allopathy would say no, evidence-based. Evidence-based, when I talk of research, they say no, this is not the right way of research. Like I was taken something on Ayurveda, one of this Arogya Pacha supplement. So I was in Canada, they asked me, can you just bring in, I'd get it tested there. But they will not allow you to take it out from here. So they will not disclose what it was. This was long back.
Kind of fitness there. One is for health related fitness, second one for skill related fitness. Skill related fitness focusing for 4 to 5 hours per day practicing. But health related, like a kind of general populations. But the doctor says self-discipline. For anywhere health related or skill related, most important for self-discipline, self-love. The general population people, they worry about the family, works or any responsibility only. They don't focus their own health. They don't love themselves. So triangle health is most important for triangle health. So God's giving for common to all, either fitness people or non-fitness people, 24 hours common to all. So 8 hours sleeps, 8 hours rest, 8 hours work. So you just divided for 3 criteria, triangle health. One is for nutrition, first one. Second one for good sleep, 8 hours. Then second one is good nutrition, health, exercise. This triangle is most important for athlete or non-athlete, is focusing more. This is only help to the human life long. Thank you.
So I think wonderful insights from all the panelists here. we have last 5 to 10 minutes. Any questions from the audience? We are open to address that as well. Yes. You can also have a question to the specific panelist as well, or open to panel.
Hi. I just have a general question, but more focused because I'm an ex-technologist. So is there any work on AI ML where you are actually simulating an individual, like an athlete, say a star athlete, simulate him or her, and then apply whatever inputs you want to give, whether it's biomechanical inputs or dietary inputs, or that would be very difficult to do, but at least biomechanical inputs, and see the reactions in terms of that. Yeah.
So at the high end, yes, but it's done in not a cost-effective way at the moment. I think as AI grows and grows from where it is at the moment, it become more available to the individual. Where could you get to in the future? You record your performance on one of these, and then there's an algorithm and AI in the background that says this is what you need to do to improve. It's not there yet, but in theory it is. And then the other exciting area is understanding what's your limits to your performance. Not everybody can be a world champion, but understanding what you can achieve based on your body attributes. And that's the direction of travel we're in.
Sir, since you already answered one, maybe I'll request Diego to answer this. Hold the mic, please. So Diego, I'm just wondering, I'm very intrigued considering I've just offered a course for IIT Madras. They're always talking of machine learning and data and AI. And I also know some athletes are using smart watches. I think like Dr. Vasudha mentioned. How reliable is this data? And it's too nascent in India, at least in my line of work, I'm yet to explore this and I would love to. So is this happening already in your country? And what are the trackers or the parameters that are reliable, credible? And how can this be used for, predictive or preventive measures? So we can align our recommendations as support staff.
Yes, actually, there are some validation studies that have tested many of these popular devices, the Fitbit, the Polar, and many others that exist just to count calories or to measure how much calories are you burning. And it turns very interesting that even mobiles can have better performance than some of these devices. So the thing is that they tested in some protocols standardized like in meters, where you walk and you turn to the right and then to left, and it measures the amount of steps or the amount of calories that was burned. And even there are some very good and reliable data from the phones, from the smartphones. The general perspective that we have is in the full day, that it's when you are tracking the calories for the full day, and that's when you can use and compare to a dietary log. And they are not superior to each other, but they are, I guess, complemented from my perspective, because we know that the energy availability is like the stone that we are looking for. Everyone is trying to avoid it, but it's difficult to measure because you cannot calculate, actually measure the amount of calories that they are burned. We are always estimating, and since we are estimating, we need to record, as I was saying, the dietary log, because with that we can have a picture of the real intake of the person, the real, because it's also could be susceptible to subjectivism of the person. And on the other side, the tracking methods with the calories as these devices. And so they can complement. I'm talking about those two only because not using the indeed a calorimetry with the mask, because that is for the lab purposes that we measure the resting energy expenditure of this kind of stuff. But in the real life, we can combine both, and we will have good results.
Thank you for that, and I think my direction was more towards other parameters, because I understand by reading a few papers that there's overestimation of calorie intake, and the pedometer also is not very substantial. Sir Mark, what is your take on certain other things in athletes like heart rate variation and sleep parameters, and if we can rationalize or get this consolidated data, can that be used as some concrete data? What is your opinion?
What we do is tracking method for 15 days of the body mass changes daily. Obviously, we standardize the measurement in the morning or in the afternoon. It depends on your start, but let's suppose that you track measurements of the body mass in the morning, and you track the full calorie intake with MyFitnessPal, Macros, or many other apps that exist. So with the total amount of calories and the body mass through 15 days, what we do is a model of what will be the amount of calories when the change in body mass is 0. And that will be the maintenance calories that we look for example, starting a diet or this kind of stuff. We have done that comparing to the generally used equations to estimate the first resting metabolic rate and then the physical activity factors, and it's not it's better, it's more accurate, this method. This is the one that actually the International Society of the Sports Nutrition we use as well for the clinical trials. And it's superior with these estimations of the equations because of that fact that they are estimates of different models, different populations than ours. So tracking method, it's very good, a very good way to measure the amount of maintenance calories that your athlete needs. Then you can just add or put it in deficit according to the protocol. But that is something that Dr. Bill Campbell actually has reported in some of the clinical trials that he has done. So later I can just show you.
Yes, please. Thank you.
Yeah, you're welcome.
Professor Mark has any inputs on heart rate variation, sleep monitoring in athletes, or any important validated approach? Thank you.
It's not my actual area, but I know a bit about it, and my take on it is that at a whole body level, sleep, stress, and heart rate variability is not commonplace, but the knowledge, and Fitbit and others use this, and there are specific algorithms out there. I think where there's still a lot to be done is around localized stress, in muscle groups, or looking at activities which are more explosive, weight training based, etc., where heart rate variability, I don't think, does so well at monitoring stress and load. That would be my simplistic answer.
Well, just to add on, because I think, is there something which can bridge between nutrition and different other variables? When you look at heart rate variability spectrum, or you look at other physiological functions, when you want to check them on, and then is there anything which can try and correlate between nutritive requirements and this, and how do you probably try and give a nutritional prescription based on any of these physiological parameters, if there is any? Otherwise, you use some other tool to probably gauge their calorific requirement, and some other tool to gauge their other specific stress-based requirements, and many more.
Yeah, as you said, it's important to monitor the amount of stress that the person has, and also the constant monitoring of nutrients, as Gita already mentioned it, will identify the specific needs that we have with the athletes. We normally do these kind of tests in every 2 months, or even every 3 months. It depends on the preparation. But we could have a picture of what is the stress with the training load, what is the stress from the food if they are in caloric deficit, or or if they are in sleep deprivation as well. So that trinity is that help us to monitor with the specific outcomes. I will show you some more in my keynote. But with the specific outcomes, we can just identify like thresholds when it's going to be ranked like high stress or not. And based on that, we prepare the food.
Right. I think this is a leading requirement even for us to deliver the protocol, a therapy protocol and intervention, which is all again related to what pre-assessments we do and how do we intervene, and then how post-assessment shows the results. Whether it's a base HRV to anything else, we would probably use as variables. So as we just go to the concluding remarks, just before that, I would make a mention of Professor Srivats, who is here, who is the head of Kerala Institute of Sports, Thrissur, Kerala. Thank you for being here, sir. And then you were a very patient, audience here. Thank you. I just probably would like to hear a few words from you.
Respected Madam, Chair, all the panelists over here. And at the outset, let me thank the organizers to have given a chance over here. I represent, in fact, I am only representing of course, Usha Madam is there. She would have been working with the Rani Lakshmi Bai Institute, I think. And so we have people who had been working with. And I am very glad that I was, as a specialist medical officer in the Indian Systems of Medicine, Kerala Department of Indian System of Medicine, I was a part of the organizers of the Sports Ayurveda Research Cell, and I was for 2 years as the state convener for the Sports Ayurveda Research Cell. And I would rather request the conference to take it as an example or a lead which has been already, experiment which has been done in one part of India, Kerala, and this has been in talk, and I think this was also inspiring at the All India Institute of Ayurveda to open a center, and National Institute also to this thing. We have to be thankful to Dr. Arshad, who passed away, who was also into international arena, taking Ayurveda to the international arena. I would just mention that Sports Ayurveda Research Cell had worked on all the aspects of sports medicine, right from how Ayurveda can be useful for preparing the athlete, selecting the athlete as Hemant sir told, according to their prakriti, according to their constitution, then how to nurture them, how to prepare them. So it was interesting today morning that appliances to improve the mobility, range of movement, etc. was this thing, how they were achieving it earlier by simple massage techniques as in Kathakali massage, preparatory massage, or Kalari preparatory massage, as well as in Ayurveda, the rehabilitative massages, which we are, Snehana Svedana methods, which we are using. And that itself used for preparing the athlete or the sports person for that. And then second was in Department of Injury Prevention. How we can prevent the injuries, and once injury has been happening, then how it can be managed. And being a Marma physician and Kerala being a Center for Marma Chikitsa, that is Kerala Marma Chikitsa, Bhagna Chikitsa, Abhighata Chikitsa, injury management. It had been successful in that, and there are some preparations which I take you that it is sometimes called as a wonder drug like Murivanna, which if you apply in any sort of soft tissue injuries, right from soft tissue injuries to healing of fractures, we are using that only. And it had been made popular through the Kottakkal Ayurvedashala and all because of my professor, Dr. G.S. Raju. So I tell that there is a lot of things, and now innovatively in injury management, the application of RISE phenomenon is there, ICE is there. So now we are carrying to the field, on the field injury management, we are carrying Murivanna in a steel container or something, putting it into ice box, and then application of Murivanna as, because it becomes solid, as a very cold ointment which immediately gives good relief for the pain and this one. So innovations can be done when there is a demand of the subject. And Ayurveda is, the co-science is the Dhanurveda, which has been this one. And it has, Kerala Ayurveda Marma Chikitsa has brought a lot, taken a lot from the Kalari Chikitsa, as all we know. And the third part is that rehabilitation of the injured person. On-field management, then of the field management. And then fourth one is, as Sir was mentioning, that during the off period, when they are not in the competitions, to see that they are nurtured or prepared for the next this one. Their body is prepared, their muscle tone is prepared. According to the games, if it is requires endurance, it is in that way. If it is requiring any agility, it is in that way. So this much of very wide studied applications is there in Ayurveda, and Ayurvedic massage therapies are wonderful towards that, this one. And another area, I will thank Dr. Sheila Karalam, who was the head of the Aushadhi, the government pharmaceutical agent, which designed for the purpose of sports Ayurveda research 3 or 4 special oils, even sprays and liniments, applications, lepana, which you can immediately apply and then remove also, not to grind or anything, like we have marmaguliga and other things which are there. And now we have developed to that level that Nagaradi Lepam is the one which is indicated has been made into gel form, where we can reduce the quantity of the medicine needed to be, the medicine used for one patient, now it can be used for 5 patients because it is into the gel form. So I think there is a very vast scope of that. And last to tell, we had been working on the Ayurvedic sports nutrition. And so many modagas, I would like everyone to refer to the Marma Chikitsa, if you are referring, there are many Aushadha Kanjis, that is porridges. For injury management or this one also, you have many preparations in Sushruta Samhita, Sutrasana, 46th chapter, where many preparations are there for these things. And if any institution is, I am now advocating for all the institutions who are into integrative medicine, that the knowledge is there. It has to be with the team effort, as sports medicine itself is a team job, right from the athlete to the expert. We will have to do it in such a way that, and the knowledge is there, the experience is there. I just am representing the people who are working on that in Kerala, and wish that the aim of the seminar is, or conference is achieved through our united efforts. And the knowledge, I would always tell that there is no actually secrecy. Secrecy is that when you are seeking, you will get it, is the thing. And I believe that we have to be thankful to the Aptas like Sushrutas, Charaka, Vagbada and all, because if they had kept it hidden, then there will be nothing here. So there is nothing for us to hide, whatever experience is there, whatever understanding is there. And last of all, there is a very big area of Tamil Varma Chikitsa, Varmology, where you can see that Dr. Shanmugam Nashan and all have proved that in DRDO, it has been proved that in Siachen, high altitude, the applications of Adapakalam or 2 or 3 marmas can increase their endurance to in a very low oxygen level condition. So without any medicines, if we are thinking that, okay, medicines if we are using, that is going in for doping and other thing, non-medical lesson massages, non-medical external therapies are all there in Ayurveda, which can be taken into sports medicine very easily. This is what I have to tell, and I would like to any of the institution to come up with a study for doping. Our experience is that from our government also, the secretary once remarked that your medicines cannot be used externally also because it has been not proved. Now evidence, then we told that, as the convener I told that evidence is there, sir, because last 8 years we are using, and our beneficiaries had represented the school in national school games, universities and all, and they were medal winners, and none of them proved to be doped. So that is a big area, and that also can be worked into. And see, there are some things like Muruvana I told. There is one formulation, or there are different formulations called Ashavanna. Whenever there is a stiffness, to reduce that stiffness, maybe those oils, there are preparations which have been intended for the muscles, intended for the ligaments, intended for the tendons, etc., 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 and they are very useful. We have to work a lot. Thanks for the opportunity. Thank you very much.
Thank you very much for your insightful words. I think innovation should continue, and maybe you could not understand. So
one more message, madam, and because of those success, is running a 50-bedded exclusively sports Ayurveda hospital that is in Thrissur. I wish everyone visits that. That it is the departments are being now it's under the government. This one it is called the Kerala Institute of Sports Ayurveda Research, Thrissur. Thank you.
So as I said, innovation has to continue, and a very small thing for both of you also to understand. Doctor mentioned about Murivan, it's an oil, it's an Ayurveda oil, and he talks about that getting into an ice form, and you carry that during the immediate requirement for a cold pack. So that's a medicinal Ayurveda oil-based cold pack. So well, with this remark and an interesting note from Professor S-VYASA, we come to the end of this roundtable today, and where we discussed and brought in insights of the panelists, and when we spoke on factors influencing sports performance and challenges in integrative medicine. I hope we have done our best to impart our part of what we have learned and exchanged today, and we definitely had a wonderful interactive session. And I thank all the panelists here today, and thank you all once again, Dr. Mark King, Professor Diago, Dr. Hemant Kumar, Dr. Nandagopal, and Professor Usha. Thank you very much, and thank you audience for your presence here. Thank you.
Surely it was an uplifting and productive day. It has been throughout the day. Thank you so much all the panelists and Vasudha ma'am. Now I request Dr. Vasudha to please come in front of dais, and we'll be felicitating our panelists. Dr. P. Nandagopal sir. Dr. P. Nandagopal sir, health coach and therapist. I request Vasudha ma'am to please felicitate him. A huge round of applause. Thank you, sir. A very well insight on yogic perspective for sports. I request Professor Usha Nair to come in front. Thank you so much, ma'am, for giving a very good insights. I request Dr. P. Hemant Kumar to come in front of dais. Dr. P. Hemant Kumar. He has given a very well insight on Ayurvedic perspective for sports medicine. Thank you so much, sir. Professor Diago. Thank you so much, sir. Surely it was a productive discussion. Professor Mark from Sports Biomechanics. Thank you so much, sir. Now I request Geeta ma'am, Sports Nutrition, Geeta ma'am, to come on the dais and felicitate our moderator, Dr. Vasudha. Dr. Vasudha has given a very good insights and carried the discussion in a beautiful manner. Thank you so much, ma'am. A big round of applause for Dr. Vasudha. Thank you, ma'am. We extend our sincere gratitude to all the participants present here and speakers, as well as all the panelists. Thank you so much.